If you are 65 or older, leaving a job, and planning to take COBRA, the most dangerous assumption you can make is that your Medicare deadline has been postponed. It has not. For Medicare Part B, the 8-month special enrollment period generally starts when your current employment ends, or when the job-based health coverage connected to that employment ends, whichever happens first. That clock keeps running whether or not you elect COBRA. This is where people get trapped. COBRA can look and feel like the same employer insurance you had before retirement. You may have the same insurance card, the same doctor network, and many of the same benefits. But Medicare does not treat COBRA as coverage based on current employment. If you wait until COBRA ends to think about Part B, you could face a gap in medical coverage, and depending on how long you delayed, a Part B late enrollment penalty that may stay with you for as long as you have Part B. Let me draw an important boundary right away. This video is mainly for people over 65 who delayed Part B because they were covered by a group health plan based on their own current employment or their spouse's current employment. COBRA is not always useless, and it does not always end immediately. It may still help with certain medical costs, family coverage, dental or vision benefits, or prescription coverage, but it does not stop the Part B enrollment clock. Rules can also be different for people who qualify for Medicare because of end-stage renal disease, and individual plan coordination can vary. So do not cancel coverage or make a final enrollment decision based only on a general video. Before we go further, subscribe if you want plain English Medicare and Social Security warnings without the rumors. Enrollment mistakes are expensive because people often discover them only after a deadline has passed. My goal is to help you identify the right date, ask the right office, and keep written proof before that happens. Here is the first thing to understand. COBRA continues a former employer's group plan, but it is not active employment coverage. That one distinction controls the entire issue. While you or your spouse are actively working and covered under a group health plan based on that current employment, you may qualify to delay Part B and later use a special enrollment period. Once the employment or the coverage based on that employment ends, that protection begins to run out. COBRA may continue the insurance policy, but it does not continue the employment relationship that created the Part B special enrollment period. Think of it this way. Your insurance card may continue, but your Medicare enrollment protection may not. That is why the sentence, "I still have employer insurance," can be misleading. The better question is this coverage based on current employment, or is it continuation coverage after employment ended? If the answer is COBRA, retiree coverage, or another form of post-employment coverage, do not assume it gives you the same Part B enrollment protection as active employee coverage. Now let us get to the most practical part of this video. The two dates you need to write down. The first is the day current employment ends. The second is the day the group health coverage based on that current employment ends. Whichever happens first is the date that matters for starting the Part B special enrollment period. Suppose your last day of work is June 15, but the employer keeps your active health plan through June 30. The earlier event is the end of employment on June 15. Social Security describes the 8-month special enrollment period as beginning with the month after the employment or the group health plan coverage ends, whichever comes first. In that example, you should not count from the date COBRA eventually ends. You should act based on the end of current employment and confirm the exact enrollment deadline with Social Security. The reverse can also happen. You may still technically be employed but lose eligibility for the group plan because your hours are reduced or your job status changes. If the active job-based coverage ends first, that earlier loss of coverage can start the clock. This is why I do not want you to guess from memory. Ask the employer or benefits administrator to confirm 3 things in writing: your official last day of current employment, the final day your health coverage is considered based on current employment, and whether the coverage after that date is active employee coverage, retiree coverage, or COBRA continuation coverage. You are not simply asking whether the insurance card still works. You are asking what category the coverage falls under for Medicare enrollment. The next mistake is counting from the wrong event. The 8-month Part B clock does not begin when you open the COBRA packet. It does not begin when you elect COBRA. It does not begin when your first COBRA premium is due. And it does not restart when COBRA ends. Medicare says you generally have up to 8 months after you stop working or lose the job-based health insurance. Whichever happens first, to enroll in Part B without a late penalty, whether or not you choose COBRA. That is the myth this entire video is correcting. A person may elect COBRA because it offers familiar doctors or helps cover a spouse. The COBRA coverage may continue for many months. But the Medicare Part B deadline can expire while the COBRA policy is still active. That creates a dangerous false sense of security. You are paying a premium. You have an insurance card. Claims may still be processed. Nothing in daily life feels like an emergency. Meanwhile, the Medicare enrollment window is closing. And waiting until COBRA ends does not create a fresh Part B special enrollment period. COBRA ending is not treated like losing coverage based on current employment. Now let us talk about the two consequences people need to understand: a coverage gap and a late enrollment penalty. First, the coverage gap. If you miss the 8-month special enrollment period, you may have to wait for Medicare's general enrollment period, which runs from January 1 through March 31. Under current rules, Part B coverage generally starts the month after you enroll during that period. Depending on when your special enrollment period ended and when you apply, that can leave you without the Part B coverage you expected. This matters because COBRA may not pay as though it were your primary insurance once you are eligible for Medicare. For people who have Medicare because they are 65 or older, Medicare generally pays first and COBRA pays second. Medicare warns that if you are eligible for Medicare but have only COBRA, the COBRA plan may pay only a small portion of your medical costs. That can leave you responsible for much more than you expected. Second, the Part B late enrollment penalty. The penalty is generally an extra 10% added to your Part B premium for each full 12-month period you could have had Part B but did not enroll and did not qualify for a special enrollment period. In most cases, that extra amount continues for as long as you have Part B. Let me be precise here. Missing the 8-month special enrollment period does not mean every person instantly receives a penalty the next day. The penalty calculation is based on full 12-month periods of delay. But missing the special enrollment period can force you into a later enrollment window, create a coverage gap, and allow the delay to grow into a long-term penalty. That is why the safe approach is not to see how close you can get to the edge. Contact Social Security before the 8 months expire. Now let us separate Part B from prescription drug coverage, because this is another place where people mix up the rules. Part B covers medical services such as doctor visits and outpatient care. The 8-month special enrollment period we are discussing is specifically about Part B enrollment after active employment coverage ends. Prescription drug coverage has different rules. A COBRA plan may include prescription coverage that is considered creditable, and Medicare says you may have a special enrollment period to join a Medicare drug plan when that COBRA drug coverage ends. But that does not extend the Part B deadline. In plain English, a COBRA prescription benefit might protect you from a Part D late penalty if it is creditable, while the Part B clock is still running from the end of current employment or job-based medical coverage. Do not use a Part D answer as a Part B answer. Ask the benefits administrator for a written notice stating whether the prescription coverage is creditable, keep that notice, and separately confirm your Part B enrollment deadline with Social Security. You also need to ask what happens to COBRA when Medicare begins. If you have COBRA before you enroll in Medicare, your COBRA medical coverage may end when you sign up for Medicare. However, the result can differ for a spouse, dependents, dental benefits, vision benefits, or prescription benefits. If you already had Medicare before becoming eligible for COBRA, you may be allowed to take COBRA as secondary coverage. The order of enrollment matters. That is why you should not rely on a coworker's experience. Two people can work for the same employer and still reach different outcomes because one enrolled in Medicare before COBRA and the other enrolled after COBRA began. Instead of asking the benefits office a long list of disconnected questions, start with 3 clear ones. Ask, when I enroll in Part A and Part B, exactly which parts of my COBRA coverage will end. Then ask, what happens to my spouse or dependents when I enroll in Medicare? And finally ask, once I am eligible for Medicare, which plan pays first, and what will COBRA refuse to pay if I do not enroll in Part B? If dental, vision, or prescription coverage is handled separately, ask the administrator to explain that in the same written response or show you where it appears in the summary, plan description. Now let us apply the rule to the situations most viewers are likely to face. If you retire after 65 and elect COBRA from your own employer, do not let the length of the COBRA offer distract you from the shorter Medicare deadline. The employer plan may be available for many more months, while the Part B Special Enrollment Period is already running. The same warning applies when the active worker is your spouse. If you were covered through your spouse's job and that employment ends, electing COBRA as the dependent spouse does not restart the Part B clock. There is also a situation that may lead to a different answer. You might leave your own job and move on to your spouse's active employee plan. Because that new coverage may be based on your spouse's current employment, ask Social Security whether it preserves your ability to delay Part B. And if you are already on COBRA and suddenly realize that you never enrolled in Part B, do not wait for COBRA to end. Ask Social Security whether you are still inside the special enrollment period. If you are outside it, ask what enrollment option is available now, when coverage can begin, and whether a penalty may apply. Do not let embarrassment delay the call. The earlier you check, the more options you may still have. Before you make the calls, put the paperwork in front of you. This is a better use of time than trying to remember every date while speaking to a representative. Have the COBRA election notice, the employer's coverage termination notice, proof of the last day worked, your Medicare information if you already have it, and any notice about creditable prescription drug coverage. If your spouse's employment created the insurance, have that employer's information available as well. Then follow 5 practical steps. Step 1. Confirm the trigger date. Use the employment and active coverage records to identify the earlier event, and ask Social Security to confirm how the special enrollment period applies to your dates. Step 2. Start the Part B enrollment process before the 8 months expire. Social Security handles Medicare Part B enrollment. You can use the official online process, or you may be able to submit Form CMS 40B, the application for enrollment in Medicare Part B, together with Form CMS L564, the request for employment information. Social Security may require proof that the group health plan was based on current employment, so do not wait until the final week if you can avoid it. Missing or incomplete employment information can delay an application. Step 3. Get a coordination answer from the benefits administrator. Confirm which coverage pays first, what ends when Medicare begins, what happens to family members, and whether the prescription coverage is creditable. Get the answer in writing whenever possible. Step 4. Use SHIP for free personalized help. The State Health Insurance Assistance Program provides free Medicare counseling and is not connected to an insurance company or health plan. A SHIP counselor can help you organize the questions to take to Social Security and the employer. Step 5. Keep a paper trail. Save every notice and every form, including the CMS L564 employment information and any credible drug coverage notice. Write down the date of each call, the official phone number you used, the representative's name if available, and what you were told. If an enrollment decision affects your coverage or money, ask for confirmation in writing. A brief written answer can be much easier to use later than your memory of a telephone conversation. There is one final boundary to remember. If your Medicare eligibility is connected to end-stage renal disease, the coordination rules can be different, including a coordination period when COBRA may pay first. People under 65 who qualify through disability can also face different employer size and coordination rules. Those situations deserve individualized help from Medicare, Social Security, the plan administrator, and SHIP. Before you finish any enrollment call, ask the representative to repeat 3 personal details back to you: the month your special enrollment period ends, the earliest date your Part B coverage can begin, and whether any proof or form is still missing. Write those answers down exactly as they are given. That turns a general Medicare rule into a deadline you can actually use. And if the employer and Social Security appear to give you different answers, do not simply choose the answer that sounds more convenient. Ask each office to explain which part of the decision it controls and request written confirmation when the answer affects your coverage or premium. If you are helping a spouse, parent, neighbor, or older relative retire after 65, share this with them before they sign the COBRA election form and put Medicare aside for later. And here is the question I want you to think about. Are you counting your 8 months from the end of employment, the end of active employer coverage, or the end of COBRA? Do not post Social Security numbers, Medicare numbers, addresses, or private documents in the comments. The safest answer comes from your actual dates and an official enrollment review. Subscribe for more plain English Medicare warnings and send this to someone who is retiring after 65. One corrected date on a calendar can prevent months without coverage and years of unnecessary premium costs.